Hello students, today we will discuss an interesting image which is very common in day-to-day surgical plastics, especially in the diabetic patient with the diabetic foot as such. So what this image is, look at this foot image. You can see that all destruction here, osteomyelitis actually, destructed bone, eroded bone, even second one, even something in third, something in the fourth also, something in the fifth also, third not much. So you can see that all destructed areas, you can see this is the lateral X-ray, this is the AP X-ray. So you can see in both also destruction, although this is a typical X-ray foot showing osteomyelitis of metatarsals. Very typical X-ray of osteomyelitis. Remember, it's very important. Diabetic foot, osteomyelitis of metatarsals are very common, which is very difficult to manage as such. So what are the features? All these things are the features common in diabetic, common in smokers. Pain, recurrent discharging ulcers, sinuses, difficulty in walking, and then got neuropathy also, autonomic neuropathy, sensory neuropathy, motor neuropathy, then microangiopathy, macroangiopathy, high blood sugar, recurrent infection, osteomyelitis, peripheral vascular disease, so altered gait. So all these things causes a lot of problem and persistent problem in the diabetic foot. Eventually they land with destructive amputations. The recurrent sepsis, remember classification, this is important. You can go through the book. Meggett's classification, good old classification, University of Texas classification, Amit Jain's classification, the Indian from the Bangalore, renowned diabetologist, diabetic surgeon, diabetic foot, other management, surgical management, diabetic foot management, renowned surgeon. He has got his own classification. He managed a lot of such patients. Pedis classification, perfusion, extent, depth, infection, sensation, all these things you can always go through. The most important thing, management, wound debridement, reperfusion surgeries. So many surgeries, maybe there is a peripheral arterial block, then you may have to think of peripheral angioplasty, then grafting, thrombectomy, endo surgeries, then profoundoplasty, increase the perfusion, increase the collaterals, and of course with the drugs, with the blood thinners, a small dose of aspirin, clopidogrel, salestazole, and so on. VAC therapy is very important in such a wound therapy. You have to remove this bone, all those bone sequestrum has to be removed. Proper wound debridement is very, this toe may go off. And skin grafting later once everything heals after VAC therapy. Limited acid drainage is the newer concept. Please go through that. Amputation, everything fails amputation. Prevention and foot care is most important in diabetic foot. This is the very crucial. MCR chappal, microcell rubber chappal, all these things are very important, remember. So diabetic foot is very common entity which surgeons face. We should know basic thing how you will manage. We should know the classifications, remember. So go through my clinical methods, how to examine peripheral vascular disease, diabetic foot, ulcers. My surgical book, Manual of Surgery, current edition, details about ulcer, arterial disease management, thrombectomy, profoundoplasty, all those revascularization procedure, operative surgery details about the technical aspect, of course, suturing technique, and my DigiNow through JP Publisher details everything as a lecture video, covers everything as for UG and CPG. So I hope you understood the diabetic foot concept, basic thing very well, student. Thank you very much.